हेलो एवरीवन। जब हम स्वॉलो ट्रायल्स में देयर इज अ कॉन्सेप्ट कॉल्ड खांसी किया तो स्वॉलो फेल, खांसी नहीं किया तो स्वॉलो पास। इज दैट ट्रू? डज रियली कॉफ डिसाइड्स योर स्वॉलो evaluation? Does really that decides that patient is aspirating and that really decides that patient is suffering from dysphagia? सोचने वाली बात है। Independently, cough doesn't decides that patient is having dysphagia or patient is aspirating. We have to see whether the dysphagia is because of neurological factor or any structural factor or because of any obstructive dysphagia. Then we have to also see some other components apart from cough, like whether the patient has any gargling voice, whether there is any change in voice quality, whether they have any history of pneumonia or any other dysphagia related issues previously, or whether they have any signs and symptoms of dysphagia which is leading them to cough whenever they are eating, or the positioning while swallowing and the frequency of bolus whatever they're taking. We have to need to check all these factors individually and independently. Cough doesn't decide your swallow evaluation, either it is fail or pass. So please do change this concept that खांसी किया तो swallow fail and खांसी नहीं किया तो swallow pass.